nowadays in obstetrics. Today's video, I'll be mainly talking of the signs and symptoms at various stages of pregnancy. So viewers, this is a very common question. This is a very favoritely asked questions in whether it be the professional exams or it in the various professional PG entrance exams, whether it be the medical, nursing, wheresoever the these MCQs in the form of MCQs, these questions have been asked quite a lot. So today's video I'll be mainly focusing upon the different signs and symptoms what are manifested at various stages of pregnancy, that is the first trimester, the second trimester, and the third trimester. So beginning with, so in the first stage, that is the first trimester of pregnancy, the symptoms, what the expecting mothers mostly show, it can be summarized in the form of a very beautiful mnemonic, that is, you are my best friend, where every alphabet of you are my best friend, that is UAMBF, will correspond to one of the symptom what the expecting mother is having during the first trimester of pregnancy. And during the first trimester of pregnancy, firstly the time duration what is there, it is up till the first 12 weeks. So the first trimester is up till the first 12 weeks, that is the first 3 months. So the mnemonic what is there is the you are my best friend, where every alphabet, that is UAMBF, will correspond to one of the symptom. So the U stands for increased urinary frequency. So what the expecting mothers mostly say, that during the first trimester there is an increase in the urinary frequency, means there is an increased micturition. Alright, moving to the next, that is R. A is referring to the amenorrhea, means there will be no menses from the time duration from the time where the pregnancy begins and up till the childbirth. As such, there is no menses, so there is complete loss of menses, there is no menstrual bleeding, so there is amenorrhea. Now moving on to the next M, the M is referring to the morning sickness due to the HCG hormone. So the expecting mothers during the first trimester, when they wake up, they have certain kind of a morning sickness like feeling. This is due to the hormone, that is the human chorionic gonadotropin. So it is due to this hormone, this morning sickness is seen. So M is referring to the morning sickness. Moving on to the next, that is the best. So B of the best is referring to the breast discomfort. So during the first initial stages, the first trimester, the expecting mothers mostly they complain of this, present with the symptom of some kind of a breast discomfort is there. And last but not the least, that is the friend, the F of the friend is referring to the fatigue, means they easily get fatigued, they easily get tired. Now since this was the mnemonic as to very easily as to how we can very easily remember about the symptoms what are manifested in an expecting mother during the first trimester. Now moving on to the size of the uterus, as to what is the size of the uterus during the first trimester and how is the position of the uterus. So beginning with, so the size of the uterus in the first trimester, it is the uterus enlarges to the size of a hen's egg. Do remember that during the first trimester, the size of the uterus is somewhat of a size of a hen's egg. All right. So okay, now when the pregnancy reaches to the 8th week, so if it is the 8th week of the gestation is there, the size of the uterus assumes somewhat of a cricket ball size. So the shape of the size of the uterus is slowly and gradually transforming. Initially it was at the end of the 6th week, it was somewhat about the size of a hen's egg. At the end of the 8 weeks, it assumes somewhat of a cricket ball size, and by the time the 12 weeks is achieved, the size of the uterus assumes the size of the fetal head. So the size by the 12 weeks of the gestation, the size of the uterus assumes the size as the infant's or the fetus head is having. So the size of these were the variations what are there in the size of the uterus during the first trimester. Now moving on to the next, that is the position of the uterus. So when looking at the position of the uterus, it in the first trimester, it remains somewhat in an intrapelvic region. So the uterus, the positioning of the uterus is somewhat, it is going to lie below the pelvic region, and that is intrapelvic region. It is not protuberant. All right. So intrapelvic location of this uterus is there. A few females, do remember, a few females and during the first trimester may experience bleeding at the time of implantation. So when the implantation of the fetus, when the implantation of the zygote is going to take place, the time the zygote, it the morula, the blastula, the gastrula, the as the implantation is going to proceed. So when this implantation is going to occur and it is going to the fetus is going to attach to the uterine wall, there are some females who may experience some kind of a bleeding, and this bleeding at the time of implantation, it is referred to as the placental sign or the handman's sign. So this is the handman's sign. All right. So this is the handman's sign. And moving on to the next, the symptoms what are there. So this was the end of the first trimester. Now moving on to the second trimester, the symptoms what are manifested. So the symptoms what are manifested at the second trimester, it is the second trimester, somewhat the time duration between of the second trimester is ranging between 13 weeks of pregnancy to the 28 weeks. And the symptoms what are seen, it is the first symptom, it is the quickening. So what is quickening? Okay, namaste. So what is quickening? So as the pregnant woman, as the expecting mother enters into the second trimester, she could feel some kind of a quickening movement. That is the perception of the active fetal movements. Active fetal movements is felt by the expecting mother by the 18 weeks of pregnancy in primipara and 2 weeks earlier in multipara. Now, what is this primipara and the multipara? So, the expecting mother is going to feel some kind of a active fetal movements by 18 weeks. All right, if it is primipara, means the mother who is expecting for the first time, or a woman who is expecting, or a woman who is conceiving for the first time, this kind of a quickening movements of the fetal movements is perceived by the woman who is expecting for the first time. That is, a primipara is a woman who is expecting for the first time, and it is somewhat perceived 2 weeks earlier in a multipara woman, means who is expecting for the second or the third time, apart from the not the first time. So multipara is a woman who is expecting, who is having pregnancy for the second time or the third time, or in the successive pregnancies. Now, moving on to the first symptom was quickening, and next symptom, it is the progressive enlargement. Now, during the second trimester, what is going to happen is that there is some kind of a progressive enlargement of the lower abdomen. So the lower abdomen of the woman is going to show somewhat of a progressive enlargement by the growing fetus. Now, what are the signs what are being exhibited? So symptoms are what the patients or the expecting mother is going to tell to the clinician. But looking at the signs, what are the signs what are seen in the, okay, so what are the signs what are seen? Okay, I'm zooming it. So what are the signs what are seen? Okay, okay. So what are the signs what are seen in the second trimester? The signs, it is the first sign, it is the cholasma. So cholasma, it is some kind of a pigmentation on the forehead and the cheeks. You must have seen, viewers, that the pregnant woman, even after pregnancy, there is some kind of a pigmentation of the forehead and the cheeks. It is prominent, it is quite evident during the second trimester, which is referred to as the cholasma. And the signs, what are the breast changes what are seen? So the breast, amongst the breast changes, there is going to appear the secondary areola. So areola is some kind of a blackish pigments what are present on the teat or the nipple, and the secondary areola means secondary blackish pigmentations, they surround the areola. So there is appearance of the secondary areola, there is secretion of the colostrum during the second trimester, and there's thickening of the colostrum. The colostrum is the first formed milk in the mother, so there is thickening of the colostrum, what is seen in the second trimester. Now moving on to the third trimester. So during the third trimester of pregnancy, what changes, what are the symptoms, what is it being exhibited? So beginning with amenorrhea persists. All right, as you must have be very well aware that during the period of entire pregnancy, menses or the menstrual cycle is not going to happen. All right, so the amenorrhea will persist during the third trimester. Enlargement of the abdomen is progressive. Slowly and gradually, the abdomen is going to enlarge. The progressive enlargement of the abdomen is quite visible, and this progressive enlargement of the abdomen is going to lead to some kind of a mechanical discomfort. Some kind of a mechanical discomfort the expecting mother is going to have, and this can be manifested that in the form of breathlessness or dyspnea and palpitation on exertion. So whenever the expecting mothers during the third trimester, they are going to have some kind of an exertion, they are going to have some kind of a physical work. So they are during the third trimester, they are most susceptible, they are most, it is mostly seen that these women, they mostly show some signs of breathlessness along with palpitations. Means now they are very much pretty well aware of their heart rate. So the woman becomes conscious of the heart rate upon exertion. So this kind of a symptom what is seen during the third trimester. Fetal movements are pronounced. So the quickening movements was what was there in the second trimester. Now during the third trimester of pregnancy, the quickening movements of the fetus are more pronounced. They are felt, they are perceived to a much greater extent. Now moving on to the next symptom, that is the frequency of micturition, it reappears. So initially during the first trimester, frequency of micturition is more. By the second trimester, it comes down to a little bit normal, but during the third trimester, the frequency of micturition again increases. So the frequency of micturition again it reappears. And moving on to the last but not the least symptom, that is the lightening. So what is lightening? So what is mostly seen is at the end of the 36 weeks, at the end of the 36 weeks of pregnancy, especially in the primigravity, that is the pregnancy, the women who is having pregnancy for the first time, a sense of relief, a sense of relief of the pressure symptoms is seen. So the pressure symptoms what the expecting mother was having during the first and the second trimester, so a sense of relief of the pressure symptoms the expecting mother is going to have. How? Because during the baby it drops down into the abdomen, into the lower abdomen, and it settles down on into the lower abdomen. So as the baby in the primary gravity, that is the mother who is expecting for the first time, the baby is going to settle down or drop down into a lower position in the pelvic region. It settles down. So some kind of a sense of relief from the discomfort, a sense of relief from the pressure symptoms is mostly seen by the mother during the third trimester. So this kind of a sense of relief by the dropping down of the baby into the pelvic region or by the settling down of the baby at the third trimester, it is referred to as the lightening. So viewers, this was a very short video. I have tried my level best to simplify and to summarize all the signs and symptoms, most of the signs and symptoms of the first trimester, the second trimester, and the third trimester of pregnancy. If you still have any queries or comments, you're most welcome to comment me in the comment sections. And viewers who are new to my channel and they haven't subscribed yet, go do subscribe my channel, and don't forget to press the bell icon so that you can be further updated for my upcoming videos. If you like this video, give this video a thumbs up and share amongst your friends. Thank you for watching.